brain with and without first. So when you come in, you're gonna look at this screen, so you're gonna wanna hit the examination tab. I'll try to stand over here so I record. And then we're gonna register our patient, right? In that upper right-hand corner, we're gonna do patient register. And then this is where we would put in our patient's information, their height and weight, all the information that was on their screening form. So go ahead and enter that, but after you hit the weight, I want you guys to stop and hold up, okay?
Do you want us to do last name and?
Pick any name and pick anything you want. Now on practical day, you would be going off of your sheet and entering the appropriate stuff, but for practice purposes, you can enter anything.
You're missing that number. Five two. 80 pounds. Feel that right, 'cause we're learning his weight.
Okay, everybody get that? All right, so now you're gonna go up and you're gonna hit that program, is it selection? I can't read it from here. You're gonna hit that tab. And you're gonna click on the, Brain Assist, so go to Brain. And you're gonna, click Brain again, and then click on Brain Assist. So what this is doing is this is going to populate images for us, so we have images to scroll through. So you're gonna go ahead and you're gonna hit the exam. You'll have to put in patient orientation head first. However, we're putting our patient in, so we're head first supine. And now you can hit that exam tab. And then we're gonna hit yes. And we just want, when this pops up, and always give it, try not to get click happy because it's cloud-based, so it takes a second or two for these to pop up. But we want this program to run, and you see how there's that working man in front of that NPR? We wanna take that working man off, cause we're just gonna run that whole protocol. And now go ahead and hit go. And that's just gonna run, and then what it's gonna do is it's gonna populate images over here that we can scroll through. So remember how last week, like the sagittal, we only had one image, we couldn't scroll through it. So now we're gonna have some images that we can select over here to scroll through to set up our planes and then go through some anatomy. Alright, so now what we're gonna do is now we have to add in, we have to pick the protocol that we wanna run and we have to bring it over. So there's different ways that you can do it, okay? So you can come over here and you can hit this plus button, or you can go down to the bottom and you can click on, I think it says My Exam Cockpit. Either way, it's gonna bring up the same thing, okay? Now, we want to bring over the brain with and without, so it looks like yours is highlighted, brain with and without. You can highlight and drag it over, or you should be able to hit that arrow button and bring it over. And just
Highlight that, hit the arrow.
no, if you hit the arrow, it should bring it over. I don't know if it's just slow.
It brought over this brain too. And then
See, it's spinning right now. We had issues with this yesterday. You might have to highlight and drag it over, but you should be able to just arrow it over.
How do you highlight these?
Now, yep, so if you click on the scout and then hit your shift key. No, oh, you gotta hold it down.
It's gonna take
Oops, I'm not sure. Two. Okay.
I
did it
clicked
say
that,
that?
it
She's
brought
trying to get
over
that
brain
video.
two, but it never said copy.
We've already
When
got
I clicked the arrows.
Alright, let's do that. Alright, so just, if you click on your scout, hold down your shift key and click here. Okay, now let up, you can drag the whole thing over. And I don't know if it's just being really slow right now. There it goes. Alright, did you get yours pulled over?
Yes.
So, when you pull over that head scout, if you notice there's no working man, did you get yours pulled over okay? Okay, there's no working man in front of that head scout. So when you pull that over, it's just gonna automatically run. That's okay as long as your patient's inside the bore and already set up, okay? So if they're not, you might wanna hold off on pulling that over. But yeah, once your patient's in there, it doesn't matter because we don't need to necessarily open up the scout because we don't change anything or do anything. That's just a dirty scout that's running to show us some quick anatomy so we can start planning our planes, alright? So that's how you pull your protocol over. Now keep in mind, that's pulling over the whole protocol for the brain with and without, and we're not doing the entire thing, right? So just make sure that you're going in the proper sequence, alright? And if there's a sequence that has the working man on, so let's say, step 11 right there, for this one, we're not doing a diffusion, I think we're going down to the flare. Anything that's not been run before that is gonna prohibit you from running your actual scan. So you can, there's a couple things you can do. If we're not gonna use it, you can go ahead and delete it. You can drag it down to the bottom, or you can just go ahead and let it run maybe. But just know your image isn't gonna run until whatever is being worked on in front of it. If it hasn't ran, then the next one's not gonna run. Does that make sense? Alright, anybody have their lab manuals pulled up? So what's the first thing we're gonna do? What's number 1 on that practical sheet? What are you setting up? It's a T1 sagittal. So
It's like someone will answer eventually.
So we're doing the T1 sagittal first, so just like we did last week, we did a T1 sagittal, okay? So we're gonna look at our sagittal image there with a field of view box around it. We're gonna center that anatomy in that field of view box. Okay, so we're centering our anatomy in the field of view box. What is our phase direction going? It's because you didn't run your scout yet. So for some reason, it got copied again.
Yeah.
So go ahead and right click on it
Oh, we ran it.
and just go down and hit delete.
Yeah.
So, and now open up your T1 sag.
This need to be ran. This need to be ran.
Yep. So, so if you scroll up, you can see what, so yep, it's all dark. And then what you can do, so when there's a protocol that you already ran, you can double click it and just don't do the scout because it won't give us any. So it'll come up with that routine tab and it will show you parameters that were used for it. Alright, so we're looking at the field of view, we've got it nice and centered in our field of view box. That nose is in there, so we're not worried too much about wrap. If we were, we could have that phase over sampling on, which it is on at 30%, I believe, right now. Go ahead and bring yours down a little bit more inferior and anterior.
Good.
There you go. What direction is our phase going?
AP.
It's going A to P, and we can check it in two different spots, right? So when we're looking at our field of view, we have an arrow right here, okay, and that's showing us the direction, and if we come down here, phase encoding direction, it's telling us right there that it's going A to P. If you wanted to switch it, you would click on that arrow and then you could change it. But we want it to go A to P, don't we? Okay. What's our slice thickness and our gap? And then on this Siemens, the gap is that distance factor that we have to hover over. Yep, we want our slice thickness to be at 5, and the distance factor, when we hover over it, it should be 1. So you're gonna have to change that percentage. You're gonna have to decrease it. Once you do that, so what are we angling with? So we're setting up the sagittal, what are we angling with? We want our slices to angle with what? So if we're looking at the axial reference image, okay, we're looking at axial, yep, and we're looking at coronal reference image. Alright, so our slices should be parallel with the longitudinal fissure or our falx. Okay? So we're gonna probably, and I like how she just took her slices off, now she can see it better. So she went up and she did that line mode, took her slices off, and now she can angle right down the center of that. There you go. Yep. A little bit more.
Closer, right? My right. Your right. Left.
My left.
Yeah, your right.
Good job.
There you
And you might need a slight angle on that coronal, that's being kind of nitpicky, but scroll through your couple images on that coronal. Oh, there it goes. Looks pretty good. Alright, what is our coverage looking like? So now we've done field of view, we've done our phase, we have our slice thickness and gap, we've angled appropriately. Okay, so what's our coverage? What should our coverage be? Do we have too many slices, not enough slices?
Too many. Isn't it just temporal lobes?
Oh, yeah.
Yep. So Madison said temporal lobes, you wanna make sure your temporal lobes are covered from right to left. So she is at 29 slices, we can probably take a couple off. Now scroll through your images, scroll through that coronal, scroll through that axial, and make sure you have your coverage.
Move 25.
Okay. So she took it down to 25, that's okay. 27's okay too. Just keep in mind if you start taking it down too tight, alright? It's always better to err, I'd say, on a slice or two over versus a slice or two under, alright? Because you never want to cut out your anatomy. You don't want to slice into air and have extra slices you don't need, but you definitely don't want to cut out anatomy either. Okay. Alright, so what weighting is this?
T1.
It's a T1. Are we T1 weighted?
Yeah.
No.
So now we've got to check our parameters and make sure our weighting's appropriate.
375.
So what's the range of TR for a T1?
300 to 700.
300 800 to 700, yep. Is your TE okay?
Yes.
Okay. What's the range of your E? TE?
10:30.
1030, 525, I forget exactly what
I've
it
heard
is.
different ones.
Yeah.
Your physics book is slightly different than your procedures book. The parameters out of your procedures book are, in here, so if ever anybody's in doubt, okay, it is copied in the instructor's manual. Alright, so if you did everything that it's saying on that sheet and you like it, you can go ahead, yes, Andrew.
I don't know what, Evan, that's been like that all the time.
I'm so glad I did that right and I didn't click the wrong thing. Alright, so if you like it and you did everything, you can go ahead and hit go. Now, what's the next thing that you're gonna set up?
T2 for axial.
So it says T2 flare axial, so that's the next one that you wanna open up.
Yeah.
So once you already have one open, okay, it's not gonna let you open another one. You have to, whenever it's grayed out like this and has that arrow, so you didn't plan it, so I would hit no, okay? Now, I would drag this one up. Yeah.
Gee, thanks.
Whenever this is open, whenever one is open, you can't open another one until you close that one out. Now, this is a contrast study, so in order for us to, get our contrast, so are we gonna use that diffusion scan at all?
No.
So if you want to, you can drag it down all the way to the bottom. Drag it all the way to the bottom of your protocol. There you go. Or you can right click and just delete it. Alright, so we've set up axials before, right? Now we have this really good sagittal that we just ran that we can use. So if we look over here, this sagittal right there, you can click on that sagittal and drag it over to where your other sagittal is. And now you've got a nice sagittal to plan off of. So you're gonna click on that and drag it and drop it right there. So you're gonna click right here and drag it and drop it. Okay. So now we've got a nice image to look at. So if we're looking at our field of view, so now we're planning that flare axial. If we look at that field of view, what's our phase direction going?
Right to left.
It's going right to left. Do we want it to go right to left? We do. Yep. So we're good with that. Now, our field of view box looks a little wonky, doesn't it? So if we want to straighten out this field of view box with our anatomy a little bit more, and this is the only time you're going to hold that Alt key down, but you're going to hold the Alt key down, hold it, and then you're going to hover over your field of view box line until you get those arrows, and now you can adjust it. That's how you adjust your field of view box. We don't have to hold it down for anything else. So click in this box, and now hold your Alt key down and hover over your field of view box line. Once you get those arrows, you can move that field of view. Did you get it, Tracy? Alright, so you wanna make sure that the brain is centered. It looks like it's centered right to left. That little circle's right over that third ventricle, it looks like. Okay? That's your third ventricle right in there. Alright, so our field of view looks good. We're going right to left. What do we want our slice thickness and gap to be? Distance factor.
5 to 1.
So we want a 5 slice thickness, and when we hover over that distance factor, we want it to say 1. So we're gonna need to decrease that percentage a little bit to make it so it's a 1 gap. And then I like how you guys have angled, so they've angled with the corpus callosum here. So when we're setting up axials or transverse, we're angling with the corpus callosum, the genu, the splenium, so we're going parallel with that. Good job. And she's still nice and centered. That brain is centered in her slices. So now when we're looking at our coverage, we have our angle. Do we have not enough slices? Too many slices? What's our coverage from what to what? Yeah, we want to be to the vertex. So you want to go through the top of that brain, and you want to be through the foramen magnum. Where's that at? So double click on that image for me. Double click on that sagittal. If you double click it, it blows it up.
That's nice.
Now go and turn your slices on for me. So we're gonna go back up, yep, to that arrow. Do your line mode again. Okay. So we can see right here the opening to our foramen magnum. Can see that occipital bone coming down. All right. Do you think we can take a slice or two away?
Yeah.
And then double click it again to shrink it up. Okay. And then we'd want to move the whole thing up just a little bit, right? So we're not cutting off the top of that brain. But now scroll through your image, so you can double click it again if you want to blow it up. But scroll through your image then and make sure as you're scrolling through, because 23 gets kind of tight, right? So 23 does it, you're there. You just have to make sure you're placing it appropriately where you're not cutting out anatomy at the bottom by the foramen magnum or the top of the brain.
Is it nose to there, though, isn't it? That's why we would have it there, just nose, but
Double click.
that's important. Because Cindy told me that something stuff, if you want to include it, like in these instances, you do those lines of things. Too much work. I didn't learn that yet.
Yeah, you did. It was on the quiz.
But like I didn't. Yes. I couldn't remember what it was. I was like, I knew it.
Did you guess on it?
I like semi-guessed. I had it. I was like, no, that's the B value. I remember that was the B value. I was like, no. I remember 2000 to 2020. I remember right at that time.
Angelica said it too.
Okay, so what rating is this image?
T2.
What is specific to this? What is the sequence called?
Flare.
It's a flare, so what are we suppressing with this flare?
CSF.
The CSF. So what do we need to look at?
Version.
Yep, so you're gonna go to your contrast tab. Okay, and then on here, it says that magnetic preparation, and then underneath it, you're gonna see TI, time of inversion. Who remembers from the head module in our quiz today, what we want that time of inversion to be?
2,000 and 2,200.
Yep, so we need to change that, don't we?
Yes.
Okay.
Thank you.
Now, it's
Exactly.
not asking you to change your TR and TE, but what are they?
9,000.
Yep. It's a long TR and it's a long TE, right? And yeah, so that one's just a little bit of a glitch. And it won't let you change it. I should have wrote down which licenses I've used for which, so I know which one it is.
I was gonna say, what happens on the day if it doesn't let us do it? Should we just say we can't change it?
Well, then I'll know, cause
Okay,
it's
'cause you're
dittered
watching
out,
us.
but you'll, right, and cause I'll be sitting next to you. So, you'll have to tell me what it would be, like, you would have to actually go to it and then be like, oh, okay, it's not gonna let me change it, but I would change it to somewhere between 2,000, 2,200, okay? Alright, did we do everything it's asking us to do? Do we like it?
Sure.
Alright, then you can go ahead and hit go and let that run. What's the next one we're gonna do?
Pre-T1 coronal sphenical image.
Okay. So we wanna open that one up.
So.
Repeat that. T1, which one?
Which one? I know, because both of them say TI.
Well, that says
So-
post.
Yeah,
So this one-
so what's the difference between them? One just says T1 coronal,
This
one
one says
says T1
post.
coronal post. What does that mean?
This one's after.
Yep, it means after contrast, so we'll
Yeah.
Should we do the?
now,
this?
so for the two that's above it, are we gonna run those at all in this protocol? So you can either the two, yeah, but what I want you to do is drag it all the way to the end, because I want, when you get to your injection of contrast, I want that to pop up for you, and it won't if you have those other ones there.
So drag these two to the bottom.
So you can either delete them or drag them all the way to the bottom.
Because we are using those.
Okay. And I'll show you, so
Okay.
that inject contrast, that tab right there, inject contrast agent, so now, when you get to the point where you ran all of your pre-images, that's gonna pop up, and what that does is it's kind of like a pause, and then you have to put in how much contrast you're giving to the patient. So you're putting that in milliliters, and then what it does is when you run your post, it attaches that to your post images, and the radiologist can even see on there, okay, this is, not only is it labeled post, but it says down here 20 milliliters. It'll say how much contrast you give the patient on their image. Alright?
Should we move the post one above the inject then, or no?
No, so we
Okay.
have to inject first
Okay.
and then run the post image.
Okay.
Yep, so that looks good the way it, yep. Alright? So now we're doing that T1 coronal pre, and we just ran a really good axial, right? Like theoretically, we just ran the flare, but we also would have ran like your T2. So you can pull over a better axial over here if you would like. You're just gonna drag it and drop it.
Beautiful.
And you'll notice when you hover over them, it tells you what they are too. So when you hover over
I know, it's hard.
these little boxes over here,
So these ones.
so yeah, so like that tells you right there, I can't see it from my angle, but
T2
it's a dark fluid. Okay, that's our flare.
T1 dark fluid.
Okay.
Resolve rescan. Rescan trace.
Now, we're getting ready to set up a coronal, so we would like to have that coronal image back, right? So what you can do, it automatically disappears on this sometimes. Go to your view and go. Now find your coronal image, and you can drag that up to right here, but don't let go. Once this, and now, yep, drop it right there.
I'll be right with you, Trinity.
So you're gonna come here, grab this coronal, drag it all the way up here, and now drop it, you know? Okay.
I think it just automatically sends you direct
So
call
with
over
the,
as opposed to
take this box,
See, there's no like,
and hopefully government.
and
like
drag it
two would.
And they're actually giving us
until
a
it populates these three,
That's what's good.
and you're gonna drop it.
Good enough for me.
Yep, you have to go back to your original.
grab it again.
Fissure?
Oh, yeah. Is now.
The, yeah.
Yeah, you can use the mouse, so, yep.
Drop it right there.
The third picture?
Okay?
Yeah.
So now we can look at our field of view. So we want our anatomy, just don't cut off the top of the head, maybe go up just a little bit more, but you're nice and centered, it looks like right to left, I like that. You're gonna have to make sure too, when you're looking at your axial reference images, that your slices are perpendicular to the longitudinal fissure or your falx. So see how they're a little wonky, you wanna straighten that out, so you have straight slices there.
Now go back to the right. Yes, turn on. Okay.
So what's our phase direction on this coronal?
What was the question? Right to left.
What direction is our phase going?
Right to left.
Okay, do we want it to go right to left? Yep, we do, so that's good, okay? I'm looking at this field of view over here, that looks nice, we've got our phase going right to left. He's adjusted his slice angle on that axial reference image so that his slices are perpendicular to the longitudinal fissure or your falx. What do we want our slice thickness and gap to be?
Right to one.
Okay, we want it to be slice thickness of 5 and that distance factor to be at 1, correct? Alright, so for this coronal, so this is your first time setting up a coronal, what are we angling with? So we're gonna look at that sagittal reference image, our sagittal reference image, what are we gonna angle with for our coronal slices on that? Not yet, because we're not doing seizure protocol. What did we angle with for our axial? Corpus callosum, right? So for the axial, we were parallel with the corpus callosum. Now we want to go perpendicular to it. Okay? So if you envision drawing a line across that corpus callosum, where the genuine splenium is, that was, I can't see, tell me if it's right. That was our parallel, right?
Yeah.
Okay, so now we want to go perpendicular, so we need to put a little bit of an angle on there. Okay,
Okay.
what's our coverage? What do we want to make sure we cover and include anteriorly? The frontal sinus. See this dark area right in there? That's your frontal sinus. We want to cover the frontal sinus all the way back posteriorly. And then scroll through your anatomy, because once you can notice that your changes a little bit where things are at. So do you think you need to add slices, take slices away? Do you think it's
Take a
pretty
couple
good?
away.
And then just scroll again and make sure you're not cutting anything out. That's good.
Perfect.
So the one thing I want, so I want you to zoom out of this image for me. So when you just click in here,
Corp.
hold it, no, hold it down and pull
Corp.
back. Maybe click, don't click in any of these corners, cause they'll.
Kernels proposal corp disclose, also corp, PCP.
Hold it and drag it.
And then your
So
parallel
I want you to bring this
and
whole
the
thing down.
axial. So ax, pax, ax pair, corp. Giving you guys tips over there. Don't know what this is recording for.
So right here, you're like right on it.
You're welcome. She's gonna be gambling tips. So she got tips in the future how to be better. Don't be like me. Don't throw your money away at the Lions.
Make sure you've got your coverage, but I think you do. All right, so now what do we need to check and do? So what weighting is this?
T1.
It's a T1. Are we T1 weighted?
No.
All right, so we're gonna adjust that and make it T1 weighted.
As long as we're within the range, does it, you know,
For right now, for these purposes, yeah, no.
right?
Eventually, you're gonna start having to pay attention to your time. So if you're looking at this right here, I'm just gonna squeeze right here. So if you're looking at this right here is the overall time for the protocol, and then this time right here is for whichever one is open and you're setting it up. Okay? That's where you find the time. Here, you're gonna find like your voxels, your voxel size. Eventually, we'll start looking at that type of stuff. But all right, so did we do everything it's asking us to do? We like our angle, we have our coverage, we're properly weighted. Go to your sequence tab. What is your turbo factor? 4. Is that correct for a T1 weighted image? Say yes.
Yes.
Yeah.
So fine.
All right, so if you've done everything and you like it, you can go ahead and you can hit go. So now it's gonna run and then hopefully we get that inject contrast agent pop up. Yay! Okay, so don't do anything, don't touch it yet, okay?
Touch.
This is when we're like, okay, we need to develop contrast.
Okay, there you go. All right, so now when you get this pop-up, so you've ran all of your pre-images, right? So we're done, we're at the point where we're gonna inject contrast into our patient. So we need to communicate and talk to our patient, right? So, whether you're power injecting or you're going in and doing it manually, so now you're gonna let your patient know, this is the part of the exam where I'm gonna give you contrast. It's important that you don't reposition, okay? Because a lot of times you're going in for brains and you're manually injecting. So you're gonna wanna let them know that you don't want them to move or reposition their head. So if you were going in, this is when you would pull your patient out of the scanner. Just make sure you would never re-hit that landmark button, because once you put that laser light back on to re-landmark them, all of your images are gonna go away. Now, they're still saved, okay? They're not deleted, but they're going off of your screen, okay? So you don't have them there for your planning purposes and all of that. That's just a tidbit. Don't have, if when you bring a patient out of the scanner, just don't hit the landmark. Turn the laser light on. At least for Siemens, that's how it works. If you brought your patient out and they had to get up, well, then it is what it is, and you're having to relocalize, scout them, and realign your slices. But for your practical purposes, your patient will probably not still be in the room on the table. I would have probably already gotten them up because they're getting ready, clearing the table off for the next student. But you're gonna get this pop-up. You need to tell me, or you probably don't even have to tell me. I'm gonna watch and make sure you put in the correct amount of contrast. So this laminated chart right here. It will be sitting on this counter. And so when you look at this chart, it can help you with different conversions. So the bottom part of this chart, like let's say you were needed to convert everything to kilograms. So instead of putting their weight in kilograms or pounds, vice versa, whatever, this is a conversion chart for you, pounds to kilograms. You're gonna look at this top part right here, because this top part is where this is the dosage administration chart for OptiMark, okay? Because different contrast agents are gonna have their own type of dosing, but this is a typical dosing. So it's saying that it's going by the 0.1 millimoles a kilogram, okay? So down here it says OptiMark injection should be administered as a bolus peripheral intravenous injection at a dose of 0.2 milliliters a kilogram or 0.1 millimoles a kilogram. So you're gonna look at this and you're gonna be like, okay, so you need to know how much your patient weighed, okay? My patient weighed 110 pounds, so according to this chart, I'm gonna give them 10 milliliters of contrast. So then that's what you're gonna type in right there where it says volume. So it's gonna be 10. If that's what your patient weighed.
It was 145.
Oh, your patient weighed 145?
Yeah.
So I'll let you look at the chart.
So, do you go in between?
So you can't do like a half, so it would only be like a full milliliter. So if you were in between, then you're probably gonna go the one down. So let's say you were at a 13, so instead of going up to 14, you're probably going to do 12, okay?
Okay, so we go to 132.
So your patient weighed 145,
Yeah,
so how much are you giving them?
12.
How was that one?
Well, so like yours, I would go 13,
Okay.
okay? Because you're really close to, I mean, 150 is almost 154. I would do 13. I would do 13 for your guys' too.
Okay, so times what we're trying to do is
13, yeah. Okay. So then you're just gonna enter it where it says the volume, milliliters, you're gonna type that number, and then you're gonna hit, continue.
We don't know the agency.
No, it should pop up, I don't know if there's any options for you, I'm not gonna make you guys type that in. I mean, if you wanna just highlight the GD, the GAD button, that's fine. And then you would hit continue. Okay, so now what do you need to set up?
Post.
The T1 coronal post, okay? So now you did the pre, so guess what? That post has to match up identically, right? So you're gonna set it up the same exact way. Now, for instance, if you don't remember how many slices you used, you can double click on that pre. There's all the parameters that you used and you can see, oh yeah, okay, it was 29 slices. Okay?
Cindy told me that.
Cindy. Okay, so we want it to match up. So we're gonna do a slice, just let it go.
Slow network speed, it says.
Okay, so our phase should be going right to left. Our slice thickness should be 5. The distance factor when you hover over it should be a 1. We're angling exactly the same. So when we're looking at this axial reference image, we're gonna straighten out our slices so they're perpendicular to the box or the longitudinal fissure.
This one is so touchy. I know, like, ugh.
Too fast.
If you lost your good sagittal, pull that back over.
Is this the good sagittal?
Yep. And then we want our slices on that sagittal reference image to be perpendicular to the corpus callosum. And then we're covering from that frontal sinus all the way through the posterior brain. And we're gonna use the same number of slices that we used on our pre-coronal image. So when that radiologist, he can pull up the pre-coronal and the post-coronal, and he or she can scroll through them at the same time and be in the same, on the same slices. Because they're comparing the pre and the post.
I'm gonna just skip back.
Yeah.
And we're gonna check our weighting parameters again, right?
Yeah, they were kind of too much over here, right?
Who found her kid?
That's Sue's kid.
He's so tall.
Wow. I see there was something.
Everybody get it?
Yeah.
Did we check our weighting?
Yeah.
All right, if we set it up exactly like our pre and we've checked everything and we like it, we can go ahead and hit.
He's so tall for that.
Okay.
He gets it from the dad though.
Yep, it will. Yep, it's gonna move a boat because we're moving it right to left. This is our field of view, it looks nice and centered now, and then we just come off this angle just a little bit. So see how that other line pops up? And now you can see how that one's kind of parallel.
He's gonna find this.
He goes, what system is that?
You're welcome.
Table running. I'm like, I don't.
All right, so if you like it, you would just go ahead and hit go. Don't forget oh, never mind, it's on a different one. All right, so that's it. Any questions on the brain with and without?
Let's do it again.
Everybody's good? All right.